Community Services Director report. Anything this evening?
Yes, indeed. Good evening, everyone. In lieu of my normal director's report, I'd like to invite up our Homeless Outreach and Prevention Manager, Lacey Sisler, who's going to provide an overview of our homeless outreach program over the past year. It was in many ways a historic year for the program. We made some new initiatives, and we had some really unprecedented successes. And Lacey will introduce her team as well.
Welcome, Lacey.
Good evening. My name is Lacey Sisler, and I serve as the city's Homeless Outreach Administrator. Thank you for the opportunity to provide this update on our efforts to address homelessness in our community. Today, we will cover key topics, including a brief overview of our team, our programs, the most recent census update, program outcomes, RSO efforts, and take a look ahead at what's coming up next. So we'll begin with the team overview. Our team is dedicated to addressing homelessness in Temecula through a collaborative, compassionate, and data-driven approach. And I'd like to take a moment to provide an overview of the individuals and the roles that make these efforts possible. So starting with city staff manages the city's response to homelessness and prevention through regional collaboration, resource center operations, and the mitigation of dangerous and unhealthy encampments and other impacts of homelessness on the community. We also oversee contracted service providers, including RUHS, SWAG, and manage collaboration with local and regional providers and track and evaluate outcomes. Next up, we have SWAG. The SWAG team, formed in 2017, is made up of individuals who have diverse education and experience in social services and addressing homelessness at a city, county, and federal level. SWAG provides 4 full-time outreach workers to conduct street-level outreach and offer case management, and they focus on addressing the most severe and chronic cases of homelessness. Through a contract with the county, RUHS provides a full-time mobile crisis response team that gives field-based mental health crisis services to assist homeless and other vulnerable residents. And last, but most definitely not least, we have our core team. So law enforcement support is provided by the Community Outreach Resources and Engagement, or core team, with a comprehensive approach to addressing quality of life issues. Their dedication and collaboration are invaluable to our efforts. We could not achieve the impact we do without their support and partnership. So, with a strong and dedicated team in place, we've been able to implement and manage effective programs that address the challenges of homelessness in our community. So now we're going to provide an overview of the programs that we administer. Since 2016, the city has provided street-level outreach using a balanced approach of compassion and responsibility. Currently, addiction and mental illness seem to present our most significant hurdles. Often, it leaves individuals completely disengaged from their own recovery. Despite these challenges, SWAG, RUHS, city staff, and the core team are out daily. We are working to build trust and offer support to connect individuals with appropriate resources. So impact mitigation, the impacts of homelessness extend beyond the individual experiencing homelessness. They affect the families, their social groups, the community, and businesses. As a city, we're responsible for addressing both the individual impacts and the broader community impacts. So impact mitigation includes the cleanup of dangerous and unhealthy encampments, addressing impacts on private property and local businesses, and ensuring safety in public spaces. While balancing these responsibilities is challenging, we've found that accountability often leads individuals to accept resources. For example, during a recent large-scale cleanup we just had, an individual who had been trespassing ultimately decided to enter treatment. And interestingly, he credited his change of heart to the compassionate and encouraging conversations he was having at the cleanup site with, of all people, our cleanup contractor. So this just like really highlights the critical role of accountability paired with empathy in the programs that we're delivering. So one of our favorites, Flexible Family Assistance and Homeless Prevention Diversion Program. The Homeless Prevention and Diversion, the Homeless Outreach and Prevention Team administers the Homeless Prevention and Diversion Program, or HPDP, which provides financial assistance to Temecula residents at risk for experiencing homelessness. There are other qualifiers as well, but so this support covers expenses such as rent, security deposits, mortgages, and utilities. Additionally, for this fiscal year, we are so grateful that the council allocated $140,000 to create the Flexible Family Assistance Program. And we're just beyond grateful and so proud to be delivering this program to our community. Patrice will talk more about it, but it's designed to bridge the gap to immediate local shelter solutions for our most vulnerable residents. And we focus on households that include children in their household, and also, again, the most vulnerable, which seniors, we define as seniors, veterans, disabled individuals, and those fleeing domestic violence. Using motels and rapid rehousing funds, this program offers transitional support, connecting participants to permanent housing while helping them stabilize their lives. So we just launched this, Patrice is going to talk more about it, but we just launched this in November. We've already kept multiple families, in their houses over the holidays, and specifically one of them, a family was fleeing domestic violence and had turned everywhere. And we called every place you could think of that you could call, and everyone, they kept getting call back in 2 weeks, call back on Wednesday. They can come for an intake. And meanwhile, how many children did they have? 2 children and a mom all by themselves with nowhere to go. And we were so grateful that we were able to say, tonight you're going to a motel and we are right here with you until you're in permanent shelter. And we were able to connect them to the transitional living, so it's going to give them long-term shelter through Project Touch, and we expect to see a lot more examples like that. Skipped it. So data evaluation and strategic planning is a huge part of what we do. The city remains committed to ongoing program evaluation and measuring our outcomes, ensuring the best quality of life for all of our residents regardless of housing status. Now, while we may at times diverge from regional trends, it's done intentionally. Not to be contrarian or because we believe that we can solve homelessness alone. We know we can't. We fully acknowledge the complexity of this issue and aim to address it thoughtfully and effectively while remaining in line with our Temecula values. And this is why we prioritize data collection, evaluate our methods, and adjust where and when needed. So community business and education and response. Our staff provides community education on homeless prevention, available services, and effective ways to connect individuals to resources. We also offer guidance on how residents and businesses can respond to homelessness in their neighborhoods and ensure businesses receive the support they need to address the impacts homelessness has on their businesses. Additionally, we're the ones responding to your community reports and notifications and interacting with the community in that way too. So finally, we have our census and counts. The city conducts an annual homeless census that focuses on understanding the local population and identifying its specific needs. Additionally, the city participates in all point-in-time counts or PIT counts, which has recently transitioned from being held annually to being held every other year. And the next PIT count is scheduled for next week, bright and early at 5 a.m. on January 22nd. And so on that note, I will now transition to the results of our most recent census. So, the city of Temecula recently conducted a homeless census over 2 days, November 20th and 21st. The census focused only on the city of Temecula, aiming to better understand and address the needs of our local unhoused population. we'll kind of briefly go through some of these high-level updates, but basically through this process, we identified 50 unique individuals experiencing homelessness in the city of Temecula. In 2023, we surveyed 56 individuals, and this reflects a 10% reduction in the amount of people currently experiencing homelessness in our city. So additionally, 66% experience mental health issues. 76% report regularly using substances, and only 24% of those believe that use impacts their housing status. 88% report a history of arrests. 46% report Temecula as their last permanent residence. 74% report being homeless in the city of Temecula for more than a year. And unfortunately, a big theme we saw and we continue to see day in and day out is that many of the participants in the survey that we already know, they express continually a preference to remain outside rather than seek shelter or housing. So here you will see our census and pit count outcomes since 2017. So you'll see the census numbers are in orange, pit count numbers are in blue. As you can see, we continue to see a decrease in the number of unhoused individuals in Temecula year over year, which we believe demonstrates that we're on the right track. And revisiting the localness of the issue, our data, as we said before, reveals that 70% of those surveyed have been homeless in the city of Temecula for more than a year. 64% reported their last permanent address as being in the Temecula Valley region, and 70% within Riverside County. So while we do see transient individuals from other areas, these findings show that homelessness in Temecula is largely a homegrown issue rather than an influx from outside areas. And then also revisiting what we discussed about mental health issues. So of those surveyed, 66% reported having been diagnosed with a mental health condition of some sort, and 76% report issues with substance use. These findings highlight a strong and measurable link between chronic unsheltered homelessness, substance use, and mental illness. And these challenges significantly impact a person's willingness and ability, unfortunately, to engage in their own recovery and pose major barriers to achieving stability. Also, it's important to note that this data is self-reported and the actual numbers are likely much higher. For example, during the census, I spoke with one man who he reported he has no mental health issues and then later said, oh, well, I do hear voices, but only in one part of my head, and if I walk fast enough, I can kind of outrun them. And it's heartbreaking. Like, how do you get someone to want to go to treatment who says they don't need treatment, they just need to walk fast and stay outside? And, you know, as heartbreaking as it is, we also have people that we know that we've worked with for years who, after 5 years of having that disconnect and telling us over and over again they don't even want a bottle of water, just suddenly one day they say, yeah, let's go get treatment. So it's heartbreaking, it's hard, it's continually challenging because of these issues, but it's worth sticking with it, and we are seeing outcomes. So kind of on that same theme, perception versus reality. So while 24% of those surveyed did say that they believe their substance use does not, only 24% said that they believe their substance use affects their ability to sustain housing. They also, 80% of them did report that they had a history of arrests. So this contrast highlights a potential disconnect between self-perception and the broader impact of untreated addiction on housing stability and retention, and emphasizing the need for targeted interventions and education. So of those who reported a history of arrests, offenses included theft, drug-related charges, trespassing, resisting arrest, and assault, many of which can be linked to untreated mental illness and addiction. These untreated issues not only destabilize the lives of those experiencing them, but also have a profound impact on the overall quality of life in our community. So now we'll talk a little bit about our key takeaways that we had from the census. So expanding service connections, and the big issue here is that we discovered 20%, nearly 20% of our population, our unhoused population, does not have medical insurance, and all of them are qualified. So that is it's such a good example of like what we can discover during these censuses. So we didn't know that, we know that now, and we're already working on how to make that connection. Addressing mental health and substance use, recognizing that mental health challenges and addiction are significant hurdles to individuals getting help they need. We have to prioritize addressing these issues. And that's going to include developing targeted interventions, educational programs to bridge the disconnect between addiction, perception, and its real impacts on housing and stability. And working with our existing partners to kind of just like refine some of our messaging and exactly what we're communicating to the population. Fostering community awareness along the same lines. To build trust and strengthen relationships, we must foster community awareness of the root causes of homelessness, both to prevent more homelessness, to increase compassion, to understand the best way to respond. So we've focused on community awareness for a long time, but we're kind of like refining exactly what we're focusing on and what we want to communicate based on what we've learned. So with that foundation, I'm going to hand it over to Patrice, who will share the outcomes of our efforts and provide insights into the progress we've made.
Good evening. My name is Patrice Brown, and I've worked with the city since 2011. Raised in the Temecula Valley, I am now part of the Homeless Outreach and Prevention team, focusing on impact mitigation and financial assistance programs. I am pleased to share the outcomes of our program and highlight the impact of our collaborative efforts. In 2024, between SWAG and city staff, we successfully assisted 135 individuals in exiting the streets. Since Homeless Outreach staff began tracking SWAG success in 2021, there has been 402 street exits. The Homeless Prevention and Diversion Program, HPDP, provides financial assistance for rent, mortgage, and utilities to Temecula residents that are experiencing or at risk for homelessness, funded by CDBG. Currently, there is $1,000 of funding left for the fiscal year. Staff has expanded $6,675 of CDBG funding thus far. Homeless Outreach staff were able to assist 3 households, including 6 adults and 8 children, with HPDP assistance to sustain and obtain permanent shelter solutions. For flexible family shelter assistance, as mentioned before, we launched the Flexible Family Assistance Program in November 2024. In December, Homeless Outreach staff assisted 6 households consisting of 7 adults and 9 children in ending or preventing homelessness. 3 of these households included individuals with disabilities. Since the program's launch on November 14th, 2024, we have expended $41,209 in funding. Calling for assistance remains steady, with many households seeking low-income or affordable housing. With continued inflation and rising housing costs and very few local shelters options for households with children, we expect the need to increase. Large-scale cleanups. Thanks to a new expedited cleanup process, we were able to successfully coordinate 2 large-scale cleanups. Oh, did I skip it? Up top. Sorry. Impact mitigation. In April 2024, we began working with a new local contractor, resulting in a significant improvement in turnaround time. The contractors have efficiently cleared dangerous and unhealthy encampments while following essential guidelines to ensure fair treatment for everyone. These procedures also aim to protect personal belongings, showing respect for those impacted. Large-scale cleanups. Thanks to a new expedited cleanup process, we were able to successfully coordinate 2 large-scale cleanups addressing large cleanups on private property, addressing immediate threats to public safety, ensuring a safer environment for the community. The location was Business Park Drive, 88,000 pounds of trash, which is 440 cubic yards, and more than 22 dangerous and unhealthy encampments were cleared. Another location was Empire Creek. We had 4 encampments and 16 trash areas were cleared with a total of 102 cubic yards of trash removed from the site, which is close to highly trafficked public spaces and known for criminal activity in that area. This concludes my slides and the outcomes I've covered. Next, we'll be hearing from Lieutenant Pearson, who will be providing us with the RSO updates. Thank you.
Good evening. Mr. Mayor, City Council, City Team, City residents, good evening. I can't say enough good things about the work being done by this group of people. I'd like to briefly talk about Proposition 36. Proposition 36 overwhelmingly passed in the November 2024 election. This measure rolled back some of the reforms contained in Proposition 47, which was the 2014 voter-approved measure that reduced penalties for most drug possession crimes and petty theft. The measure comes amid an increase in high-profile smash-and-grab robberies and the fentanyl crisis. For clarification, Proposition 36 will do these 3 things. First, it increases criminal punishment for drug and theft-related crimes. Second, it creates a new requirement that people arrested for drug possession crimes be either sent to drug rehabilitation facility or state prison. Third, it requires that the court to warn people convicted of selling or providing illegal drugs to people that they can be charged with murder if they keep doing so and someone dies. From a law enforcement perspective, the passage of Proposition 36 enhances the ability of our deputies to enforce laws related to these offenses, leading to more severe penalties for these offenders. Addressing quality of life concerns within the community remains one of our top priorities. Another significant change introduced in 2024 is the requirement that trespass letters, or 602 letters as they are more commonly referred to, now be notarized. This update ensures that property owners and managers follow a more formal and standardized procedure when barring individuals from their properties, helping to eliminate ambiguity and potential misuse of the trespass law. The notarization adds a level of legal integrity to the process, ensuring that individuals who are issued trespass warnings are properly informed and that the letters are legally enforceable. This change, in conjunction with Proposition 36, reflects a broader trend towards refining and enhancing law enforcement practices in California. Together, these reforms seek to create a fairer, more rehabilitative criminal justice system, while also ensuring that property rights are respected and upheld in a legally sound manner. Thank you.
So, looking ahead, first and foremost, like we mentioned, we have our pit count next week. And then we touched on the things that we want to focus on this upcoming year that include expanding service connections, specifically getting medical coverage, addressing mental health and addiction issues, and really focusing on specifically helping to bridge that gap of that disconnect of how it's impacting the individual's outcomes. And then increasing outreach in that capacity. So kind of like refocusing some of our outreach to just really go heavy on the relationship building, really focus on actually just speaking about mental illness and addiction openly. Like, we see what you're struggling with. So we're all working together, we're collaborating to really strategize in that area. And then additionally, like we said, fostering that community awareness, once again, with specific things in mind. You know, always focusing on how do you report, how do you help, what are the ways to help that actually help and the ways that actually hinder, but also really with prevention in mind, long-term prevention, also just, again, saying it, addiction impacts homelessness. It just does, and we don't want to skirt around it, and that's part of what we want to focus on with our community awareness. Funding, we're continuing to explore new funding opportunities. Many of them are not good fits for us because they require a lot of things that don't align with our Temecula values, including reducing enforcement, halting cleanups. And while it would be great to get those funds, we just can't answer to the rest of our community and make those calls. So, but we're not gonna stop. We're continuing to look for funding. Specifically, we're looking at things that can, you know, help clean up waterways and environmental impacts of these encampments and things like that. Fire risks. So kind of trying to be a little more creative in what funding streams we're looking for now. And then we want to continue to bridge that gap, which we made a huge impact this year with that $140,000 for the flexible family assistance. But basically we discovered that there aren't really local options for families for tonight. You know, maybe you can get them into transitional living, something else that can be local, but typically families have to leave the area. And while McKinney-Vento covers the cost of transporting the children back, most parents aren't going to put their kids on a bus at 5 a.m. from Riverside to get down to their Temecula school, even though we know how important that educational continuity is. So we're gonna continue working on that and exploring other ways to connect people to those flexible, immediate shelter solutions. And with that, that concludes our presentation, and we're here for questions.
Thank you very much, Lacey,
Thank you.
Patrice, and Vic. I'm going to turn it over to my colleagues for any comments or questions. Councilmember Alexander?
Well, you guys are amazing. I tell you that every time you guys come up here, and I am so appreciative of the compassion approach that all of you, and I mean that all of you, the entire team, as one really portrays not only to the individuals, but their families, just to everybody across the board, and your hearts are definitely shown. And it's this type of job that you guys are doing, it's not just clock in, clock out. I know you guys have a lot more that you put into it that maybe not everybody sees. And so I just want to say thank you for that, for going that extra mile, whether I'm calling you, whether the city's calling you. I'll get into a little bit about you know, just one of the recent phone calls that just because I had made from somebody in a shop, a local shop had called me, we were able to help somebody. So thank you, seriously, to all of you. I know I had done a video this last year, and sometimes it's trying to find this fine line, I think, sometimes between that compassion and making sure that we have the quality of life. And again, I want to say that I believe our city does an excellent job at that. I know there's lots of hours put into having conversations to make sure that people get the help that they're needed and making sure that they're getting the hand up and not just only hands out. And that is something that I just want to, again, applaud the city and the team for doing, because it's a constant work and a constant battle to make sure that we're doing what we're doing. And we're seeing it in the numbers. We're seeing over the years our numbers drop. So hats off to all of you. You touched on mental illness. You know, obviously, we'll talk about Care Solace next week a little bit, but this is that opportunity, again, for people without coverage to get the mental help that they're needing, that the city has now provided for at least a year contract. So, you know, again, city's doing a great job with that, doing everything they can. And, you know, a lot of things people are talking about, too, is beds. What are we doing with beds? And again, I'm just giving a brief overview. This has been I've had a lot of compassion and just passion for this area, for individuals who are struggling with homelessness. But we do such a great job that we have, I believe it was 6 beds in Paris or somewhere around that, where we had an opportunity, myself and Councilmember Stu went up to Paris, I think it was. And we were able to see one of the ladies that you were kind of talking about. She was on the street for 15 years. And finally just said, okay, I'm ready. And we had the opportunity to talk to her, and she was the sweetest thing ever, and she was so thankful for the life change because you guys were consistent and continue to reach out. Let me see. Just to reach out, one of the notes here as well, I'm just about to wrap up, but the HPDP that you were talking about with the funds that we had been able to present to the public is, again, that compassion part. And if I can just give a brief story what happened, I got a call from a store owner, I think it was last week, about a family who was living in their car with a 2-year-old. And he knew I was a city council member here, and he's like, is there any way that we can get help? He's like, I want to give this man a job, but they have nowhere to go. Tomorrow, their hotel vouchers are out. They have nowhere to go, and I think they were in a hotel for a couple weeks, but car and hotel. You guys literally jumped in and got him a house, I think, right away, if I'm correct. So it saved a family from separating from CPS and gave a family an opportunity for this man to step up and get a job and continue to be able to work and provide for his family. So great job again. I want to also shed some light. I don't think this has yet been brought up to anybody in the council. Something I've been working with a little bit with our staff as we're looking at the possibility of bringing this forward. We're still talking to the city attorney about looking at a public-private partnership to bring in funding from different organizations. We did have a wonderful meeting with the hospital. There's still conversations happening with that right now and what that would look like. But I think this is a great opportunity for the community to come together to wrap their arms around each other, bring quality of life for everybody, our businesses, and at the same time making sure that we have cleanups available and moving forward. So just to put that on everybody's radar, that's kind of where we've been at. And the last thing I have as a statement is the pick count. So I am going out at 5 o'clock in the morning. So I'm just throwing it out to the 4 of you, if you would like to join, or anybody. Can anybody join on these things, or how does it work?
So this year we did opt to exclude just the broader public from the volunteers because we have so many people here that are already involved and already engaged like yourself in what we're doing. Additionally, we've noticed in the past, and a lot of our outreach workers through SWAG, they have lived experience, and they have acknowledged that sometimes it feels a little voyeuristic when you just have a lot of people coming along and they want to see and they want their pictures, and so we are doing just pretty much like who's already involved.
In-house type thing. Okay, sounds good. Yeah. So I'm just excited to see what those numbers are going to bring from the last one that you guys have for the pick count. So the last thing is not even a statement, but it's a question, if you can answer this. If we have an individual who we can say is driving by and there is a cleanup or an encampment that they are seeing on the roads, and we know they all pop up in different areas, who do they contact? How do they reach out? And or if we have a transient maybe situation where he's just laying out on the sidewalk, what is their best route to be able to get the help that they need and the quality of life to be able to get better here in the city?
So that's a great question. First and foremost, if anything seems like an emergency, please call 911. So, I mean, and it sounds surprising, but we have actually had emails that say something like, a person is passed out in the middle of a crosswalk on a major street. Like, that's not an email notification, So if you feel threatened, if you think someone else is threatened, please just don't hesitate, call 911. Second, if it's something that is related to active criminal activity happening, but isn't necessarily an emergency, we would prefer that you utilize the non-emergency number. And this, because when you use the city apps for notifications, they're not hearing about it. The other thing that I didn't know about this until Lieutenant Pearson educated me on it was that using the non-emergency number, it involves dispatch and it protects the deputies as well. Because when they're responding to someone just saying, hey, deputy so-and-so, can you go check on this? If something happens and they have to use a weapon or, they get assaulted, why were they there? So so 911, non-emergency. And then when it comes to something like an encampment, let's say, or what you think is an encampment, something like that. There's multiple ways. You can use the city app. You can just call City Hall, and they know how to get us. They know who to connect you to. They can give you our direct email. But we have a really dialed-in, expedited process now, and we're really grateful for that. So please let us know when you see those. We can respond quickly. Most of the time, we can respond same day now. And then, was there another avenue that I
I
missed?
think you nailed it.
Okay.
Great job. Thank
Oh,
you,
and then
guys.
if you just
yes.
know someone that needs help,
Yes.
just still, again, you can always go straight to just the main number with City Hall. On our website, it shows our outreach numbers, it shows SWAG's number.
You guys are doing great. Thank you
Thank
for
you
all
so
your hard
much.
work. Thank you.
Directors, anything else?
I'll just keep it short and sweet. I know we're all grateful for city staff, SWAG, our UHS, and our core team. I understand how difficult it is with the resource resistance and them wanting to remain outside. So you said accountability paired with empathy, and I think that was the perfect way to put that. As well as the educational continuity. I think that's huge, and all of my colleagues agree that keeping those kids that have they could be displaced out of Temecula, keeping them in Temecula by any means is what we prefer. I know you guys work hard and are diligent at trying to do that. And like you said, it's heartbreaking, it's challenging, but you stick with it. We appreciate you for it. And we see these numbers on the spreadsheet here, and you need to think, like, we need to look past the numbers. When it said 17 kids were prevented from being homeless. You know, it's easy to just look at that and go, oh, it's 17, but it's like, those are 17
That would
children
have been
living-
outside.
Yes, exactly. So we are so grateful for everything that you guys do, and thank you very much.
Directors, anything? Director Ron?
So I got my traditional, I know you guys have missed this, but I've got a list. So a couple of quick questions. So year over year, we've got roughly 8 years now of data since programs are more or less formalized by, 2017, right?
Yeah.
And then we have drops in the homeless population along that period. We also have surveys that are conducted at the pit counts and through the city's own, resources. Can you first question is, are the surveys standardized
Oh, good question.
across those 8 years or so?
So the pit count largely is standardized. There have been some adjustments over the years, but mostly it is like what you see on a census website about like demographics, they're really focusing on things like that. So with our local focus census, we can ask anything we want and we change it. So we do focus year over year, we're asking where was your last permanent residence? Things like, do you deal with mental health issues? But we can tweak it, so we can notice like, hey, only 10% are saying they deal with addiction. What if we asked, do you ever overuse substances? All of a sudden the numbers go up. Then we say, do you have addiction? You know what I mean? So we can play with it a little bit with the census.
Okay.
But the pit count, totally standardized.
So the reason I ask is because I think at this point there's a large enough, sample size where, something meaningful could come out of that sort of trend analysis and I think also a sensitivity analysis, right? And we're putting a lot of resources financially into different parts of what we think are potential solutions to, addressing homelessness in Temecula. I think we're probably ready to identify through some, a little bit more rigorous review of the data, like the bang for your buck. What resources, staffing, whatever it is, programs are having the most impact. Which do we think have kind of leveled off, and which are maybe trending in the wrong direction? Like we're just no longer seeing value from that particular service or resource, and to be able to tie that back to some of the pit count numbers, the surveys, I think there's some important things that we can glean from that, and there's a couple of reasons why I think it's important. One is first, and I don't know if this is a possibility or not, but I would assume a lot of issues with self-reporting error on this, right? People are providing fairly sensitive information about themselves in a compromised situation, right? And so one of the concerns that comes up is, how honest are you being with us when you talk about, addiction or how long you've been homeless or, whatever the questions in the survey may be, right? And especially when the question I saw, on one of the slides and in the report had to do with convictions and, past history, how honest are they being, and have we ever compared those survey numbers to actual records, to kind of get that, sort of feel for,
Yeah.
you know,
No.
is it a self-reporting error, or is it, you know, are we getting real data that, you know, are reflective of the population? You know, little things like that I think could be pretty insightful. The other reason I bring it up is because, and you had mentioned, you know, Prop 36, Grants Pass v. Johnson, you know, all of these things have recently passed and have removed some of the legal, I think, ambiguities that have tied the hands of local government to enact what, in a lot of cases, were just common sense measures and solutions, right? Now that proposition has passed and grants passed and the Supreme Court decision, you know, have passed, there's probably a threshold here now because, you know, California is an unfortunate pendulum that goes from, you know, different ideas of how to deal with social issues, right? And so we're moving in a different direction now than we have been for the last 10 years. And I would expect to see dramatic changes in the homeless population over that time. So, you know, but if we don't track that data, if we don't collect that, and we don't understand how new opportunities have emerged, you know, I don't want to have the city be in a place, you know, 10 years from now where we're arguing with our legislature over, you know, stupid new laws that have come down the line that, you know, are going to erode, you know, what the city has accomplished here today. And not have the ability to speak to that from, you know, a data perspective and say, look, these programs have worked, you know, and so I think now's the time to kind of go through that. And so, you know, I bring all that up to say, you know, Mr. City Manager and you know, colleagues here, you know, could we work with this group, and I don't mind, you know, lending a hand on this, but maybe put together a plan to do some of this analysis, to look at this a little bit more rigorously, and to, you know, kind of bring back, you know, a bit of a more in-depth look at the progress that has been made and where maybe we can, you know, have the best benefit from additional resources. So, and then my last comment had to do with coordinating, as we were talking earlier about fire issues and vegetation management and some of the urgency along that. You know, a student of mine last year had done a research paper on homeless encampments in a portion of Riverside County, I think mostly near Corona, and the risk of fire and so forth. And it was a very compelling study. It's nothing that fire and police aren't already aware of. But, you know, I just put it out there that as we're engaging in this space of doing more aggressive vegetation management and fuel, you know, clearing in the city, that we, you know, sort of work with you all as well to identify those areas that, you know, are high risk for homeless encampments and fire as well.
And that's specifically why we did conduct that process update to cleanups to expedite it, was fueled by the fire risk of those particular sites.
Yeah, no, it's amazing work, and I'm just so thrilled to see the numbers are still trending downward, and it's just a testament to all the hard work you all have been doing, and appreciate that.
Thank you.
Director Stewart, anything? All right. Just a few things. Thanks for the presentation. I did appreciate you listing off staff members, 3 city staff, 3 SWAG, 8 core, and Lieutenant Pearson. That's 15 individuals that are dedicated to this. Not including, you know, our regional partners, right? Like, you know, the health systems and even our cleanup contractors who are clearly doing like wonderful work in the community, right? When we talk about the encampment cleanups, I think that's one of the more tangible things that you can see like in the community, right? And I think in the future, I'd like to see how many football stadiums or swimming pools or wine barrels is that? Because when you say like hundreds of yards,
I like that idea.
I think I had to look it up, like the average dumpster is like 5 or 6 yards, right? So if you see like a dumpster behind a business, that's 5 yards. If we did 100 yards worth of debris, like that's just sort of mind-boggling, right? But it's those things that you're doing that are really impacting the quality of life for the residents in our community. So I thank you for that. I appreciate the data-driven solutions, and I actually I printed this up and I have it in my office, and there's a few subcommittees that I know I'm going to be bringing this to, so we can kind of lean on that, you know, over the years when we're updating this and really having, you know, not just the numbers, but Mayor Kalfas talked about it, when you actually start putting faces to these numbers, and these are people, and having compassion for that. So I've never been more confident in the direction of this program, and it's because of you all, under the direction of Director Russo and everyone that's involved in this. I really, really appreciate everything you're doing for the community, so stay the course. Thank you.
We truly appreciate your support. Like, we're so grateful that we get to work at a city like this, where we can actually just continually evaluate, change, make an impact, keep the community safe. We're all of us are so grateful for this opportunity.
Yeah, thank you.
Yeah.
All right, General Manager, I'm sorry, Director, anything else this evening?
Nothing else. I just want to echo, we're really fortunate to work in a city that has been bold enough to do what works and not what is trendy or popular or expedient. So, and I truly believe that's at the heart of our success. And one of the most striking statistics I noticed was that as our numbers, our homeless census numbers, our PIT counts have continued to decrease, our street exits have steadily increased every year. So it's not that the problem is getting smaller. We're getting better and better at dealing with that. And I believe it's, as Lacey said, due to our ability to pivot, analyze, assess what's working, what's not, constantly change, under the support and direction of a council that is willing to be bold and take actual steps to try to fix a problem. So thank you for that.
Wonderful, thank you.